Hello, my name is Dr. Roland Illing, and I'm the Director and Chief Medical Officer for Public Sector Health International at AWS. It's my pleasure to talk to you today about trends in global digital healthcare. In particular, what I'd like to talk about is why transfer healthcare to the cloud. What the healthcare landscape is today and what it was pre-COVID, those drivers that may push healthcare organizations to go to the cloud. I'd like to talk about some international directives that influence our healthcare customers. I'd like to talk about global trends of healthcare spending that we're seeing in the market today. Finally, I'd like to talk about the AWS healthcare mission and some of the strategic pillars that we're following, and give some examples of these from around the world. So firstly, why should healthcare move to the cloud? Healthcare, like every other industry, has some absolute necessities which are driving it today. And they're driving the requirement for agility and staff productivity. What I mean by that is that healthcare systems have to adapt quickly and they have to utilize their staff absolutely effectively. Many healthcare organizations and healthcare delivery bodies have data centers which are on long procurement cycles, and these require optimization. There's a need often to go global, so international organizations, especially those involved in research, require international collaboration and the means to do so. There's a new model coming for total cost of ownership, showing that owning and operating data centers is not as cost effective as infrastructure in the cloud, and healthcare is no exception to that. There's an absolute need for improved security and operational resiliency. So with healthcare record availability is essential for the smooth running and the protection of our patients. There's a need for digital transformation. The Internet of Medical Things and artificial intelligence and machine learning will permeate all of healthcare in the next 5 to 10 years. And so to be ready for this transformation, cloud is a great enabler. And finally, of course, there is cost reduction. And we know that health systems are under enormous pressure, and we will see this in a moment. But this is another driver where healthcare is very similar to other industries, where that cost pressure needs to be addressed, and cloud is one way of doing so. So, what are some of the industry challenges that healthcare in particular faces? We know that there is an aging population, and this is global. So it's estimated that over 1/3 of the population in Europe will be over 60 by 2050. And with age and greater life expectancy also comes greater comorbidity, so people living with diseases and multiple diseases for longer. And this can be a great cost burden. There's an unmet demand or lack of capacity of healthcare personnel. The WHO estimate that there are already 14.5 million people in the workforce or workforce vacancies by 2030. There's an increasing amount of digital healthcare data circulating the planet. So the amount of healthcare data which will be generated in 2025 is 10 times that of the amount of data generated in 2016. There's a massive drive to improve efficiency. It's thought that 20% of spending in healthcare is actually non-value adding to patient healthcare. And finally, security is paramount. Over 93% of healthcare organizations are estimated to have experienced some kind of security breach over the last 5 years. And this security element is absolutely paramount. And again, the cloud is able to address some of these security concerns. And of course, all of this was before COVID. Since COVID has hit last year, we've seen significant increases in acutely ill patients. This is putting even more strain on our already stretched workforce. And there's an additional element of keeping the workforce themselves safe. There's a requirement to rapidly open new healthcare services. This is the agility I spoke of earlier about how to stand up telehealth solutions to support patients remotely. And also, how do these scale quickly? How they're able to have the largest reach in a scalable manner. How do we maintain governance in that environment? How do we ensure that the right people are being seen by the right staff? And of course, all this is increasing cost pressure on the system. A very good study from the IDC has shown some structural industry shifts anticipated. This was a survey carried out across healthcare CEOs internationally. And it was asked of the CEOs which areas they thought were going to be permanently changed as a result of COVID-19. They felt that continuity and disaster recovery frameworks would be absolutely essential. There'd be much more online and self-service for patients to manage their own care. There'd be a necessity in diversifying supply chain and changing the operating models to become more digital, reliance more on telehealth, for instance. They'd formalize remote working. As we've all seen, there's been so much home working taking place recently. And also that there would be artificial intelligence and machine learning central to disaster recovery planning. Of course, these pressures are coming from the bottom up. These are pressures faced by the healthcare providers due to circumstances around them. There are also pressures coming from what could be perceived to be the top down, so international organizations giving recommendations to national bodies that then go down to the healthcare providers in country. The World Health Organization has developed the Global Strategy on Digital Health 2020 to 2025. And this is backed up by numerous other documents, such as the Digital Implementation Investment Guide. It's important to understand that these requirements also play into the way that national health strategies are developed. Indeed, the World Health Organization has developed these 4 guiding principles around digital health. The first is that a digital health action plan must be developed and owned by each country. Successful digital health initiatives are part of holistic, integrated strategies. So that's not just healthcare, but it's also broader. It's the social determinants of health, including education, housing, transport. There's the need to promote the appropriate use of digital technologies for health, making sure the right technology is used for the right patient groups. And also that there is a need to support the least developed countries, as these often have the greatest obstacles in onboarding new digital technology. The 4 strategic objectives defined by the WHO are promotion of global collaboration and advanced transfer of knowledge, advancing the implementation of national digital health strategies, strengthening governance of digital health at every level, and advocating for people-centered health systems that are enabling and enabled by digital health. Against this, we can also see where healthcare organizations are spending their money on digital health subcategories or health system areas. We reviewed this spend from the international markets and segmented it against World Health Organization subcategories. And what we found was that the areas called out reflect what we see from our customers now. This chart shows the spend along the bottom in billions of dollars versus the rate of growth of those areas up the side, and that's the percentage year-on-year growth. We see from this chart that the two largest areas of global healthcare spending fall into the areas of genomics and electronic health records. We also see that population health management, storage of health data, and telehealth are also very high, along with imaging. The largest growth area is that of clinical analytics. So that's both business analytics and artificial intelligence and machine learning. And these are all areas that AWS are absolutely focusing on to drive the next 3 years. So to the AWS healthcare mission, we would like to enable access and delivery of person-centered care to improve outcomes at a lower cost by accelerating the digitization and utilization of healthcare data. Digitization is the move from analog to digital. So moving things from what could be paper or screen to a digital format. Utilization comes from migrating that data in a digital format from on-premises, so from fixed data centers on site, into the cloud, where they can be interrogated and the data can be used and actionable insights generated at scale. In order to do this, we are developing specific healthcare products and services. Some of these are listed here. Amazon HealthLake is an AI solution which allows ingestion of standardized data in order to transform it and analyze it in a very deep way. Actionable insights can be extracted from both structured and unstructured data. So written reports can be put into the system, which can then be actually transformed into a machine readable format. Once in HealthLake, they can either then be looked at through analytics tools such as QuickSight, or they can be fed into machine learning systems like SageMaker, so that further insights can be generated. Amazon Comprehend Medical is a medical natural language processing system which can actually take written data and transform it into that machine readable format. Transcribe Medical is a medical speech-to-text service that recognizes medical entities and can translate them appropriately. Fireworks in AWS is a tool that allows serverless adaptation of medical data into a FHIR format. And FHIR is an international standard that allows interoperability between health systems. So it allows different systems to communicate healthcare data seamlessly between them. Finally, we have AWS Service Workbench. And this is a secure, repeatable, federated system of setting up secure research environments in the cloud. So with only 3 clicks, research data sets can be stood up and access can be given to those researchers who have the requisite requirements. And all of the structures for machine learning can be made available even if you don't have on-site resources. So this is a hugely democratizing tool which will allow high-level machine learning access to data in the cloud. So to our strategy to 2023. We have 4 interlocking pillars that deliver our healthcare mission. The first is increasing the amount of healthcare data stored in the cloud, because this, once it is in the cloud, we'll be able to analyze it and be able to really gain meaningful insights from it. The second strategic pillar is making AWS the foundational cloud for population health globally. The third pillar, making AWS a global healthcare influencer and trusted partner to healthcare systems, being available at a time of need to lean into country-level initiatives to help them deliver care for their population. And strategic pillar 4 is bringing all of Amazon to our customers. So where AWS and Amazon.com can come together to create a seamless service for our end users. To give you some examples of each of these pillars, one of our customers in the UK is the UK Biobank. They have 500,000 volunteers on their system who have donated samples of all kinds into the biobank, including their genomes. AWS is working with the UK Biobank to create a cloud-based data analysis platform with the partner, DNA Nexus. And this cloud-based platform really enables transformative research to be carried out. So Professor Sir Rory Collins, the UK Biobank principal investigator, a quote from him is, "This new platform will democratize access, helping us to unleash the imaginations of the world's best scientific minds, wherever they are, to make discoveries that improve human health." For the second strategic pillar, becoming a foundational cloud for population health globally, I can reference the Biosense platform, which was the first fully cloud-based national program for population health, built in 2009 on AWS for the CDC, the Centers for Disease Control in the US. This is a syndromic detection platform linking primary and secondary care medical centers to look for satellites and constellations of presenting symptoms that enable it to classify and follow disease outbreaks. Biosense now covers 90% of the US population and actually has more than 200 presenting conditions to help keep track of disease outbreaks, which is very pertinent for the recent time. For strategic pillar 3, AWS is a global healthcare influencer and trusted partner. During the pandemic, AWS partnered with the Indian government in order to stand up a telemedicine platform at scale to support the Indian population. The eSanjeevani system was stood up in 19 days to cover 4 states. It was free to patients and accessible 12 hours a day, 7 days a week, to provide telemedicine services for people in those 4 states. It was successful, and as a result, it was rolled out to the rest of India. This telemedicine system now enables over 1 billion people to seek virtual care. That's over 80% of the population of India. There are over 6,000 consultations taking place on the platform every day across 23 states. It involves 4,000 doctors and up to 150 simultaneous outpatient clinics. And the goal of this platform is to reach 100,000 consultations per day. For the 4th pillar, creating a seamless end-to-end experience for our patients, bring all of our Amazon to our customers. Another example comes from the UK, where during COVID, AWS built a front-end platform for the UK NHS, where patients were able to register if they had symptoms. If they had symptoms, this would link to Amazon.com supply chain, who were then able to deliver those symptom tests or the COVID tests to the patient's homes, where they could test themselves and send those samples back in for processing. During the pandemic, this system was able to deliver more than 6 million tests to the UK population. And it's that kind of seamless delivery of and frictionless service to our patients is where we would really like to get to internationally. In conclusion, what I would hope you take away is that healthcare is under enormous pressure, but moving to the cloud enables customers to be more agile, to improve costs, and to scale services up and down where there is demand, and also to deploy globally in minutes. There is a mandate from the WHO to drive digital healthcare, and AWS is growing to support healthcare customers, both with technical capability and subject matter expertise. Finally, the takeaway message is that we aim to support our customers by enabling access and delivery of person-centered care to improve outcomes at a lower cost by accelerating the digitization and utilization of healthcare data. Thank you very much for your attention, and I hope you found this useful.